When indicated, clients may undergo bladder and bowel retraining to regain control of elimination. There are several strategies used to promote bladder continence. The nurse aide may assist the nurse with one of the strategies called timed voiding. Timed voiding encourages the patient to urinate on a set schedule, such as every hour, whether they feel the urge to urinate or not. The time between bathroom trips is gradually extended with the general goal of achieving 4 hours between voiding. Timed voiding helps to control urge and overflow incontinence, as the brain is trained to be less sensitive to the sensation of the bladder walls expanding as they fill. Bowel retraining involves teaching the body to have a bowel movement at a certain time of the day. This training includes encouraging clients to go to the bathroom when feeling the urge to do so and not ignoring the urge. For some individuals, it is helpful to schedule this consistent time in the morning, when the natural urge occurs after drinking warm fluids or eating breakfast. For other people, especially those with a neurological cause, a laxative may be scheduled regularly to stimulate the urge to have a bowel movement on a regular basis and prevent constipation. The nurse should communicate to the nursing assistant when bowel retraining is in place, or a laxative is administered to a client so they are aware of the client's need to defecate. A urinary tract infection, UTI, is a common infection that occurs when bacteria, typically from the rectum, enter the urethra and infect the bladder or kidneys. Infections can affect several parts of the urinary tract, but the most common type is a bladder infection. Kidney infections are more serious than a bladder infection because they can have long-lasting effects on the kidneys. Some people are at higher risk of getting a UTI. UTIs are more common in females because their urethras are shorter and closer to the rectum, which makes it easier for bacteria to enter the urinary tract. Providing improper perineal care is a common cause of a UTI. Nursing assistants must be diligent and assist with perineal hygiene as needed to prevent infections. Other factors that can increase the risk of UTIs include the following: a previous UTI, sexual activity, especially with a new sexual partner, pregnancy, age. Older adults and young children are at higher risk, urinary retention, low fluid intake, structural problems in the urinary tract, such as prostate enlargement. Symptoms of a UTI should be reported to the nurse immediately and include the following: pain or burning while urinating, dysuria, frequent urination, frequency, urgency with small amounts of urine, bloody urine, pressure or cramping in the groin or lower abdomen, confusion or altered mental status in older adults. Symptoms of a more serious kidney infection called pyelonephritis include fever above 101 degrees Fahrenheit, 38.3 degrees Celsius, shaking, chills, lower back pain, or flank pain, i.e. on the sides of the back, and nausea or vomiting. It is important to remember that older adults with a UTI may not exhibit these common symptoms, but instead demonstrate an increased level of confusion. Older adults often become weaker when they have a UTI and may fall. If you notice increased weakness or a change in the level of confusion in an older client, report these symptoms to the nurse immediately. If not treated quickly, UTIs can spread to the blood, called septicemia, leading to life-threatening infection called sepsis. When a patient has symptoms related to a possible UTI, the healthcare provider will order diagnostic tests, such as a urine dip, urinalysis, or urine culture. Antibiotics are prescribed for urinary tract infections and are administered by the nurse. Nursing assistants should encourage clients with UTIs to drink extra fluids to help flush bacteria from the urinary tract, and toileting should be offered more frequently with proper perineal care.